Hello everyone, this is the video for Chapter 9 under Deafness and Hearing Loss. Now in my years of teaching, I've only had probably three students that have come under this category, but it is a one that you definitely need to look at because it will change some of your teaching strategies, and um, I do think it makes it better as you're looking at ways to assist your students with deafness or hearing loss. Look at the homework slide as you're going through the PowerPoint and make sure you write those down to make sure and get those completed on time. You do have 2 chapters this week. Some of the chapter objectives state what distinguishes a child who is deaf from a child who is hard of hearing in terms of the primary code used for learning communication. Also describe how deafness or hearing loss affects child's acquisition and use of speech and language, academic achievement, and social functioning. Identify and the estimated prevalence of children who are deaf or hard of hearing, and describe basic types of hearing loss, common causes of each, and how the age of onset affects child's education and learning needs. Also describe the information provided by an audiogram. Identify technologies and supports used by students who are deaf and hard of hearing to amplify, supplement, or replace sound. Compare and contrast the underlying philosophies, methods, and key components of oral, total communication, and bilingual, bicultural approaches to educating children who are deaf and hard of hearing. And also briefly explain how placement can influence quality of related services, access to language and curriculum content, social opportunities, and cultural identity for a student who is deaf. Definition. Deafness is a hearing loss that is so severe that the child has difficulty processing linguistic information through hearing, with or without amplification, that adversely affects educational performance. Hearing loss means a loss in hearing that adversely affects educational performance, but that is not included under the definition of deafness. Deaf, these students use vision as a primary sensory mode for learning and communication, whereas hard of hearing, these children use their hearing to understand speech with the help of a hearing aid. So like in my case, I would not come close to either one of these, but I do use hearing aids to help me understand speech. Many persons who are deaf do not view hearing loss as a disability. And you'll need to remember that, especially as you're going through the discussion board for this week. How we hear. Audition is complex and not completely understood process. The outer ear is the external ear and the auditory canal. Auricle funnels sound waves into the auditory canal and helps distinguish the direction of sound. These also include sound waves are amplified as they move toward the tympanic membrane, and variations in sound waves cause the eardrum. Sorry, woke up a little earlier this morning getting started. Sound is measured in units that describe its intensity and frequency, and you will need to know what these three are for the quizzes. There are some questions related to decibels, intensity or loudness. 0 decibels represents the smallest sound a person with normal hearing can perceive, and sounds of 125 decibels or louder cause pain to most persons. Hertz is a frequency or pitch of sound measured in cycles per second, where pure tones consist of one frequency only, the frequency range most important for hearing spoken language, 500 to 2000 hertz. Characteristics. Students who receive special education because of hearing loss are a heterogeneous group. Sorry, my grandson's getting up trying to get this done before it. Levels of functioning are influenced by type and degree of hearing loss, age of onset, attitudes of the child's family, opportunities to acquire a first language, and the presence or absence of other disabilities. Generalizations about how deaf people are supposed to act and feel must be viewed with extreme caution. Students with hearing loss have smaller vocabularies than their peers with normal hearing, and the gap widens with age. learn concrete words more easily than abstract words, have difficulty with function words and omit endings of words, and have difficulty understanding and writing sentences with passive voice and related clauses. The academic achievement. Atypical speech is common in many children who are deaf or hard of hearing. Students with hearing loss have difficulty with all areas of academic achievement, especially reading and math. The gap in achievement between these children and normal hearing and those with hearing loss usually widens as they get older. So it may not be, um, as wide when they're younger, but as they get older, it will tend to increase that gap. Problems attributable to inadequate development of the first language and mismatch between the demands of spoken and written language and the student's ability to understand and communicate English. Social functioning. Behavioral difficulties in school and social situations are more likely with children with hearing loss than with those with normal hearing. Students report the feelings of depression, withdrawal, and isolation frequently reported by children and adults who are deaf and adventitious hearing loss. The extent to which a child with hearing loss successfully interacts depends on others' attitudes and the child's ability to communicate in some mutually acceptable way. The prevalence, the large majority of persons with hearing loss are 65 years of age or older. Males are more likely than females, and during the 2012-2013 school year, about 77,000 students between 6 and 21 received special education under this category. This represents only 1.2% of all school-age students who receive special ed services and about 0.1% of the student population. A national survey, about 39% of deaf or hard of hearing students had severe or profound hearing loss, and about 40% had another disabling conditions. There's different types. There's conductive hearing impairment, results from abnormalities or complications of the outer or middle ear, and then sensorineural hearing impairment, which entails damage to the cochlea or involves abnormality or failure to the auditory pathway, mixed hearing impairment, combination of conductive, sensory, and neural hearing loss, unilateral and bilateral hearing loss, acquired and congenital, and prelingual and postlingual. And you'll want to go through some of these types a little bit more in the book. Causes, there's genetic. I probably have my hearing loss due to more genetic factors. My father and grandfather both had hearing losses as they got older. Maternal rubella, congenital, prematurity, causes of acquired hearing loss, otitis media, meningitis, Meniere's disease, and noise exposure. Identification and assessment. The Joint Committee on Infant Hearing recommend that all infants be screened at 1 month. Auditory brainstem response, pure tone audiometry, assessed using an audiometer, speech reception test, alternative audiometric techniques like play audiometry, operant, conditioning audiometry, behavior observation audiometry. Technologies and supports. Of course, you have hearing aids. There's digital, programmable hearing aids, and the earlier in life a child is fitted, the more likely he will learn to use hearing. Group assistive listening devices, a radio link established between the teacher and the child. And I will try to make sure that when I get done with this video that I put an example. I have one on YouTube, an example of a teacher and a student with hearing loss that I think will be great for you. Cochlear implant, it bypasses damaged hair cells and stimulates the auditory nerve directly. Controversy surrounds this, and I think you'll hear that on the video that is associated with your homework assignment for your discussion board. Supports sign language interpreters, signing the speech, a teacher. And I've used this and had students use this. And you do, as a teacher, you need to make sure that you take the time to talk to the interpreter and the student involved to see what their needs are. Typically, I would have them sitting towards the front, and then I would need to slow down some of the sections that I was doing to make sure that they were getting it. Possibly, after class, some time to get together to make sure there weren't some things that they need to have a little bit more information on. Speech to text translation. Computer devices translate speech to text. television, video, and movie captioning, printing text that appears at the bottom of the screen. Text telephones allows the user to send a typed message over telephone lines to anyone who has teletype, and computer technology and learning devices. And this is going to continue to increase, so just keep an eye on the different advances out there, especially if you have students that are in this category. Educational approaches. There's the oral or oral approaches, auditory learning, speech reading, and cued speech. There's total communication, manually coded English and finger spelling, and of course American Sign Language, or ASL. It's the language of the deaf culture in the USA and Canada. It's more of a bilingual, bicultural approach. So you need to look at these three areas, study them in the book for the tests and quizzes. There will be some quiz questions on this one. Placement options. Majority of children who are deaf or hard of hearing attend public schools, and 54% receive most of their education in regular education classrooms. So the regular education teacher will be the ones that will primarily be having them in class. Only 17% attend resource rooms for part of the school day, 16% are served in separate classrooms, while only 4% attend residential schools for the deaf. About 40% of all students with hearing loss go to college and receive education at college. So for the most part, special ed teacher will just have to monitor many of these students, check hearing aids, make sure they're working was one thing that we did for some of the students. For those with cochlear implants, there is some cleaning involved that the student has to be ready to do. So this might be a self-help skill that you might be working with as they get older to make sure that they clean where the post is and keep that from getting infected. That's one of the things that can happen with those. Let me go back here, make sure I haven't touched, forgot some things here. As far as discussion board, let's go down through that. Scroll down here. There is a story, a discussion topic from National Public Radio from October 12th, a few years back. I want you to listen to that, and I believe there's both written and audio to go along with that. I will also try to make sure and add a video about deafness to this PowerPoint later on this weekend, so that it's ready for you next week. But the difference on this one I want you to realize is I want you, after you post yours on Thursday, since there are 2 weeks or 2 chapters this week, Thursday is when this would be posted. Then I want you to come back Friday, Saturday, or Sunday and respond respectfully to at least 2 points of view from other peers that you disagree with. Okay, make sure that you understand. I want you to find 2 that you disagree with, and then do some discussions with that. So remember that point. Otherwise, I'll let you get on with your work, and you have a good week.